Hey guys, how are you? So guys, our today's topic is about the peptic ulcer. So guys, before watching my lecture, if you guys are new to my channel, then please subscribe to my channel and click the bell icon. Okay, so let's begin our lecture. So guys, before going into detail of peptic ulcer, we must know what is the peptic ulcer. Okay, so we will write its definition. So guys, what is the definition? The definition of the peptic ulcer is a breach. It is a breach. Peptic ulcer is a breach or cut, but the best word is a breach. Breach in the mucosal layer of of the three things, either the stomach or small intestine or the esophagus. Okay, so guys, the peptic ulcer is the breach in the mucosal layer of either the stomach, the small intestine or the esophagus. Okay, so the one which is in the stomach, that ulcer is known as gastric ulcer, and the ulcer which is in small intestine is known as duodenal ulcer, and the ulcer in the esophagus is known as esophageal ulcer. Okay, and these are its types. Okay, there are three types of peptic ulcer, and these three are the types as well. Okay, so the peptic ulcer is the breach in the mucosal layer of the stomach, intestine or the esophagus, and its type is the gastric ulcer, duodenal ulcer and esophageal ulcer. The gastric ulcer is the ulcer in the stomach, duodenal ulcer is the ulcer in the small intestine, esophageal ulcer is the ulcer in the lower esophagus. Okay, I forgot, lower esophagus. Okay, so this is about its definition and what is the peptic ulcer. But now we must know that how this breach in the mucosal layer is caused. Okay, so let's talk about its causes, that how it is caused. And the main thing which cause it is, let's write h. pylori. H. pylori is the main bacteria which causes the peptic ulcer, H. pylori. Okay, so where does it cause? In the mucosal layer. And but how does it damage? We will talk about it. Just for example, there are 6 layers of stomach, 6 layers. Okay, 6 layers of stomach, like 1 2 3 4 5 6. The last 3, this is from outer to inner, the last 3 is known as the mucosa. Okay, and the first one is the serosa, longitudinal muscle layer and the circular muscle layer. When this one is damaged, this one is also damaged, and this one is also damaged, then when there is the start of the breaching of the mucosa, then it is known as peptic ulcer. Okay, so H. pylori is causing it. And there are some other factors as well, like spicy food, smoking, alcohol, frequent use of NSAIDs, and sometimes the poor secretion from the stomach as well, but that is due to some other diseases. So the main cause is H. pylori, and what causes will help, what things will help? Spicy food, too much smoking, too much alcohol, and frequent use of NSAIDs. Okay, so these are the factors which are helping the H. pylori we can say they are making a situation in which H. pylori can work easily. Okay. So still we must know that how this H. pylori is causing the breach in this mucosal layer so deep into the stomach. This is from outer to inner, and it is in inner layer of the stomach. So how it is causing? Let's talk about its pathogenesis. That how it is causing. Like for example, H. pylori enters the stomach. H. pylori enters the stomach. Now what it will do? The H. pylori has an organism which is known as urease organism. What this organism is going to do? It is going to act on the urea, and what urea will do? Urea will secrete ammonia. So the main thing that H. pylori is doing is helping in more secretion of ammonia inside the stomach. So now what the body will do? Body's antibody will come. It's antibody, and it will start producing inflammation antibodies. So the ammonia and antibody will combine, and it will produce what? Peptic ulcer. So what is producing it? The ammonia and the antibodies. And the ammonia will come, antibody will try to defend against it, and there will be inflammation produced, and the inflammation and ammonia together will cause peptic ulcer. But as we know that inside the stomach, whenever a bacteria comes, it is eliminated by the gastric juices. So why the gastric juices are not eliminating the H. pylori? The reason is that what ammonia does, ammonia neutralize the acid in the stomach, and what antibodies are doing, it will cause inflammation. So more inflammation and neutralization of acid, then it will cause the breach in the mucosa, the layers in the mucosa. It will causing inflammation will start causing breach, and the spicy food, all of it helping, and the mucosa will be breached, and then we will say that it is peptic ulcer. Okay, so this is all about the pathogenesis of the peptic ulcer. The main thing is the combination of ammonia and the antibodies. Okay, so now let's discuss its symptoms, that what will be the symptoms. So now a person is going to come to you, and he will be complaining about what? He will be complaining about dyspepsia. So what is dyspepsia? Dyspepsia is epigastric burning and pain. So for this you will have to diagnose the patient, and the patient is the main problem, the main symptom in the peptic ulcer is dyspepsia. So you will have to diagnose it. For that you must know about all the regions of abdomen as well. So let me tell you. For example, this is a body. Here is the pelvic region. From here to here is the abdomen. Here is the chest. Okay, so abdomen has how many regions? 9 regions. Okay, remember. And this region, this one is the epigastrium. So the pain will be here, and there will also burning as well. And the burning is going the severe burning will radiate up to where? Radiate up to the heart, chest and the esophagus. Okay, radiate up to chest and the lower esophagus. Okay, so it is very dangerous, and it might wake the person up at night. Okay, so this is the main symptom of the peptic ulcer. By this you can diagnose it. And there are some other symptoms as well, like changes in appetite, changes in appetite, nausea, vomiting, and like indigestion, bloody or dark stools. These are some other symptoms, and sometimes also the chest pain. Okay, so these are some normal symptoms, uncommon symptoms, but the most common and the most definitive is dyspepsia, which is the epigastric pain and burning. This is the epigastric region of abdomen, has 9 regions, and this the uppermost and in the middle is the epigastric region. So you can diagnose it from there, and you can then send it for the tests as well on this basis. So what are the tests with which you can diagnose it perfectly? For perfect diagnosis of H. pylori, the perfect diagnosis is by the upper endoscopy. Okay, so how this upper endoscopy is done? They will insert a tube through the mouth and into the esophagus, and the tube by the tube you can see inside for ulcers, and you can also take tissue for test. Take tissues from the abdomen for the tests. Okay, so in this way you can do. This is the gold standard test for H. pylori. Okay, so this is the best test, but sometimes this test can also fail, and the person will say that I'm still having symptoms, so I need some other test. Maybe I can find out that I have H. pylori, so we can start the treatment. So there are some other tests like urea breath test and stool antigen test. So these are other tests that we can perform for diagnosing the H. pylori. Okay, so after we have diagnosed the H. pylori by the dyspepsia and by this upper endoscopy, then what we are going to do, we will have to start the treatment, and its best treatment is 2 antibiotics plus 1 proton pump inhibitor, proton pump inhibitors, omeprazole, like this. So which one is the first line? The first line treatment is, which drugs are the first line treatment? calithromycin, metronidazole, and 1 proton pump inhibitor, which is omeprazole. These are the first line treatment. Okay, and this one is, both of these are for how much time? And first let me tell you, this is after meal, and the omeprazole is before meal. We will going to administer all the proton pump inhibitors before meals for its perfect result. Omeprazole is for what? The burning, and the calithromycin and metronidazole are to clear the bacteria. Okay, for killing the bactericidals. Okay, so for how much time we are going to administer it? For 3 to 5 days. So the treatment will go on for 3 to 5 days, and the person will be cured. These 2 drugs are to kill the bacteria. Metronidazole is basically antiparasitic, but it also has effect on the bacteria as well. And omeprazole is for heartburn. Okay, the burning which is caused in the epigastrium here. Okay, so guys, this was all about the pepticulcer. If you like my video, then please subscribe my channel and click the bell icon. And if you guys want me to explain something more in it, or if you guys want me to explain something in detail, then you can also comment in the comment section. And if you guys want lectures on some other topic, or in more detail, then you can just comment in the comment section and I will make the videos for you. Okay, thank you guys, thank you so much, and guys please subscribe my channel and click the bell icon. Okay, thank you guys, bye bye, see you.